Hello everyone, good morning. I am Nidal Father. I wanted to present you about the hepatic lipidosis disease and I hope you will like it. So let's start. What is the hepatic lipidosis disease? The hepatic lipidosis in the cat, also it's called feline fatty liver syndrome. It is the most common liver disease in cats, and we should know that the disease that totally unique to cats and doesn't occur in any other animal. And this disease officially has no known case, though obesity is known to increase the risk. Now, this disease begins when the cat stops eating from a loss of appetite that lead to forcing the liver to convert body fat into usable energy. But if this process continues for too long, fat builds up in the cells of the livers, and the disease has officially onset. And we should note that the chances of hepatic lipidosis occurring are greater if the cat was overweight or obese before the anorexia began. What are the possible cases of this disease? Now, if someone asks about the main cases to the hepatic lipidosis disease, one of the reasons a cat may be stop eating is separation anxiety and the emotional stress that results moving, gaining or losing housemates or pets. Going on vacation or a prolonged boarding are all common situations that pets owner report just prior to the onset of the disease. But it may develop without this condition. Exciting obesity is known to increase the risk of hepatic lipidosis. However, there is no known official case of this disease. Severe anorexia usually precedes the onset of the disease when cat has no energy from eating. The liver must be metabolize fat deposits in the body into usable energy to sustain life. The cat liver, however, is poor at metabolizing fat, causing a buildup of fat in the cells of the liver, leading to fatty liver. At this point, the disease can be diagnosed. However, it will often not be diagnosed, and many animals are euthanized due to the improper. Now, the normal body condition before this disease. Now, in the normal states and without this disease, the cat eats in the normal position and is doing a good digestion of all food stuff inside her body, where the digestion process begins from mouth, as she has a good teeth to tear and grind food in a preparation for its digestion, and with the help of salivary gland in the mouth, then it will transport the food. The ground is best through the esophagus until it reaches the stomach, where it takes up about 8 hours in the stomach depending on the component of the food. When the food transport to intestinal stage until the process of digestion, absorption and energy is used to the cat. Now, when the food reaches to the first part of the small intestine and the duodenum, bile is secreted through the bile duct, where the bile helps in the digestion of fat. Then the pancreatic secretion is introduced into the food, where the enzymes are necessary for the digestion process, because without them the nutrients would not be small enough to enter the bloodstream through the mucous membrane of the intestine, and this makes absorption difficult as the nutrients are absorbed through the protuberances on the stomach walls. It should be noted that the small intestine is the most important organs in the digestion process, although a food stays in it for only 1 to 2 hours and the nutrients enter the liver, which is responsible for metabolism among other things. But the body condition after the hepatic lipidosis disease. Now I will talk about what this disease is doing in the cat body, especially in the liver. Now, when fat is broken down rapidly to supply energy and the nutrients to our anoretic cats, it can overwhelm the ability of the liver to process it. This fat becomes stored in and around the liver cells that lead to an increased compromising liver functions. Here we must note that the liver becomes partially weak and does not work well enough. Also, that we will find the cat it's not normal in terms of its food, and this will negatively affect its health. And with this, I need a veterinarian to make an appropriate diet in line with disease until we reach a cure from this disease. And as we know, to feed the cat, a feeding tube must be inserted. Through this tube, the food will reach to the cat, because the cat needs about 6 to 7 weeks to return to eating on its own, or until to return its appetite. So it is preferable to give your cat a weekly meal of her favorite food, for she start trying to return her appetite and its own and it's eat in her own. How is hepatic lipidosis diagnosed? Now, if someone asks how we can diagnose this disease, now the hepatic lipidosis shares similar symptoms to other problems, including liver disease, kidney failure, feline leukemia, feline infectious peritonitis. And some cancer diagnosis requires tests that target the liver. To make an accurate diagnosis of hepatic lipidosis is made from blood tests that demonstrate poor liver functions and from a liver biopsy or fine needle aspirate. The latter may be performed during an exploratory surgery or by inserting a needle into the liver through through the skin. The liver sample is sent to veterinarian doctor for analysis. A cat with hepatic lipidosis will have large amount in and among the liver cells. The other diagnostic test may be performed in an effort to determine why cat originally stopped eating. Now, the symptoms of this disease. As we know, each disease has many symptoms. Now we will talk about the hepatic lipidosis. Anorexia always precedes liver disease. With the cat refusing to eat enough for days or weeks, this may be amplified by frequent vomiting when the cat does choose to eat. Now, a lack of appetite causes the cat to refuse any food, even after it has purged its system of all stomach contents. Severe weight loss proceeds as the liver keeps the cat alive of body fat, that causing a yellowing of the skin. Now, when the cat runs out of fat to process, severe muscles wasting takes place as the body converts proteins into energy. Eventually, the body cannot give the brain enough energy to function properly, and the cat dies from malnutrition. In addition, an overworked liver can eventually fail, causing total system collapse. Now, the early stage, lack of appetite, vomiting, anorexia. But the late stage, jaundice. Ways to prevent or treat this disease, if any. Now, is this a treatable disease? The hepatic lipidosis is treatable with aggressive nutritional supports until normal appetite returns. A constantly high level of nutritional support is required for the liver to resume functioning, so it may mobilize the excessive fat stores. This takes an average about 6 to 7 weeks. Therefore, a method of feeding must be used that allows you to feed your cats at home, while nutritional support is the most important component of a treatment. Many cats are also treated with the medication to support liver function. That's mean we can't reversible the disease through intense feeding, and this treatment maybe involve the insertion of a temporary feeding tube to ensure adequate caloric intake for cats that have stopped eating as a result of this disease. Now, untreated, the disease has mortality rate upwards of 90%. Cats treated in the early stages can have a recovery rate of 80 to 90%. Left untreated, the cats usually die from severe malnutrition or complication from liver failure. A treatment usually involves aggressive feeding through one of several methods. Finally, the best method to combat feline hepatic lipidosis is prevention and early detection. A best increase the chances of onset. In addition, if a cat stops eating for 1 to 2 days, it should be taken to a vet immediately. The longer the disease goes untreated, the higher the mortality rate. Finally, thank you for listening to me, and I hope you enjoyed in this presentation. So stay healthy.